Morning, welcome back. 7:41 is your time. This is a year of many changes in the healthcare world as healthcare reform takes center stage. Seton Family of Hospitals has already started integrating and collaborative care efforts for the Central Texas community. Joining us now is Dr. Mark Pirwitz. He's president and CEO of the new Seton Heart Institute. Thank you so much for being here.
Thanks for having me.
You're welcome. Tell me all about the institute.
Well, I think it was formed to provide high-quality care at lower costs and to provide greater access to care for more and more patients in the Central Texas community.
Are there more people suffering from heart problems these days?
Yeah, I mean, it's the #1 killer in the U.S. as it is in Central Texas, and so I think the cooperation between the hospital system and also all the physicians, I think, will help to improve those outcomes and to decrease costs.
My brother-in-law is a cardiologist in Little Rock, Arkansas, and he moved there because there are so many people there that are suffering from heart disease.
Yeah, I mean, it's, as I said, it's the #1 killer in the U.S. and it's very prevalent here in Central Texas, and I think it's just the cooperative care amongst the physicians and the hospital is going to be necessary to be able to take care of all those patients.
What's unique about this center?
Well, I think there are a couple of things. Number one, it's a Seton facility, so Seton's had a great reputation in the community to provide access to care for all patients, no matter what. Secondly, I think it's very patient-centered. You're not just a heart when you walk in the door. You're more than just a heart patient. You may have other medical problems too, and Seton's able to provide that care for all those types of patients. Third would be the relationship with UT Southwestern, a medical school in Dallas, which is one of the premier institutions in the country, to provide house staff training. In other words, residents and fellows here in Austin, and also to provide collaboration in terms of cardiac research and things like that here in Austin.
With the new changes in the healthcare system and healthcare reform, how are you guys addressing those needs that patients may have?
Well, I think that to understand that, I think you have to look at the goals of healthcare reform, and some of those goals are to reduce costs, to provide access to care to more and more patients, and also to have better outcomes, and to be able to measure those outcomes and to prove the things that we're doing actually impact the patients.
And you guys have just been open just a few months. How have serving patients gone? Do you have a high number of patients already?
Yeah, we're very busy. I think we have a lot of great facilities here in the Central Texas area, from up in Williamson County to Hays County to here in Central Texas, and so there are quite a number of terrific cardiologists that can provide that care, and a number of great providers.
Excellent. Thank you for being here. If you need more information, there is the information on your screen. If you'd like to make an appointment with Dr. Pirwitz, you can call 324-3440. Thank you.